Do you frequently feel like your heart aches sometimes? Or maybe you're so tired after walking to the kitchen that it feels like you ran a marathon. What if I told you these could be signs your blood isn't working right? Meet acute myeloid leukemia, or AML. It's a serious cancer where your bone marrow, the factory inside your bones that makes blood, starts making broken bad worker, white blood cells. Instead of fighting germs, they multiply wildly and crowd out healthy cells. Think of it like a jammed assembly line where only faulty products are made, and nothing useful like oxygen-carrying red cells or clot-forming platelets gets through. That's why people with AML feel awful fast. Their body is starved of what it needs to function. So what causes AML? It's not contagious, you can't catch it from someone else. But certain things can damage the DNA in your blood-forming cells. Imagine your DNA as the instruction manual inside each blood cell. If pages get ripped or rewritten by mistake, the cell might turn rogue. Things like smoking, yes, cigarettes are big offenders. Radiation exposure, like from past cancer treatments, can also scramble those instructions. Some rare genetic disorders like Down syndrome increase the risk too. Ever worked with benzene, a chemical found in some factories, or gasoline? That's another known trigger. But many people with AML have no clear cause. It's like a random system error in the body's software. How would you know if something is wrong? Let us play a quick game. Raise your hand if you have had any of these lately unexplained bruises, like you bumped into a wall. You do not remember frequent nosebleeds, fevers that come and go, or feeling so weak you need to nap after short walks. These are red flags. Because AML messes up red blood cells, you might look pale or feel short of breath climbing stairs. Low platelets mean you bleed or bruise easily. And with faulty white cells, your body cannot fight infections. Well, so small colds turn into big fevers. Some people even feel bone pain, like their skeleton is aching from the inside. If 3 or more of these sound familiar, it is time to see a doctor, not to scare you, but to check the system. Diagnosing AML starts with a blood test, simple, like checking the oil in a car. If the results look weird, too many white cells or too few red ones, the doctor might order a bone marrow biopsy. It sounds scary, but it's a quick procedure where they take a tiny liquid sample from your hip bone. Under the microscope, they can see if the cells are abnormal. Once confirmed, treatment starts fast. AML grows quickly. The main weapon, chemotherapy. Think of it as a full system reboot. Strong medicine kills the bad cells, but also harms good ones, so you might lose hair or feel sick. After chemo, some patients need a stem cell transplant, a reset using healthy donor cells, like installing new software. The goal is remission, no signs of cancer. But it's tough, and treatment depends on age, health, and genetics. Can we prevent AML? Well, not fully. Some causes are out of our hands. But we can reduce risk. Let's talk choices. Do you smoke? Quitting is the #1 thing you can do. Avoid long-term exposure to chemicals like benzene. Use safety gear if you work around them. Radiation. Only get medical imaging when really needed. Living healthy, eating well, exercising, avoiding toxins helps your body repair itself. While these don't guarantee you won't get AML, they stack the odds in your favor. It's like wearing a seatbelt. You hope you never need it, but it's smart to have on. The good news, science is making progress. New drugs like venetoclax target cancer cells more precisely, like a smart missile instead of a bomb. They're used with chemo to help older patients who can't handle strong treatment. Scientists are also studying immunotherapy, training your immune system to spot and kill leukemia cells. And gene testing is now part of standard care. Doctors check the DNA of the cancer to pick the best treatment. Some trials are even testing vaccines to prevent relapse. It's not a cure yet, but survival rates are improving. Hope isn't far behind.